Hi, I'm Sarri, and I am introducing you to an online course called Naming and Taming Overwhelm for healthcare and human service providers. So, the whole purpose of this course is to have some nuts and bolts, really clear ways for us to dig ourselves out of overwhelm and help your staff and your entire organization begin the process of recovering from overwhelms. I've actually written a book on overwhelm, naming and taming overwhelm for healthcare and human service providers. So, what you're going to find in the class is that it's broken down into really tiny bite sized sections. So, because you know what? Overwhelmed people, they don't have 3 hours to sit down for an online course. They have to do little bites at a time, a couple minutes here, a couple minutes there. So I guide them through in really small bites, maybe 15 minutes at a time, and then give them an exercise to do. And those guided exercises, while they go through the course, they save those guided exercises. And then those can be used to have really good, deep conversations with a whole team or a whole organization on overwhelm recovery. And through the course, they're guided to kind of collect their own experience, their own thoughts, their own understanding, their own recovery steps. And then your administrators or team leaders and managers have the guide to use as a way to figure out how everybody's doing with this and what can they do together as a team. And so in the course, I go through what are the signs of overwhelm? How do we recognize it? What does it mean? How is overwhelm different or the same as trauma? Because that does come up a lot. And I explain the treatment needs for working with patients and clients who are overwhelmed. And then how do we help clinicians and providers recover from overwhelm? So what are the steps that we would do if we're working with overwhelmed patients? And what are the steps that we do if we're working with overwhelmed providers and ourselves and helping ourselves to recover? So I want us to understand all of the care needs in that context. And then the final part of the training is on overwhelm inside of organizations and systems. And what are some of the steps that we can take to bring that overwhelm down and to recover as an organization? What are some of the leadership pieces involved? And then my final notes are on community overwhelm. What happens when an entire community is overwhelmed? And what steps do we take there as providers and as people that work within the context of a community, in addition to the context of a system? So all of this is in the course. There's guided worksheet to help people answer their own questions. Those questions can then be used to facilitate great conversations within teams or within whole organizations. So you don't have to create any of that. It's all provided right there for you. And they can also work through the course at their own pace. And so you might be able to buy the class, buy 25 seats or 250 seats, however many you need. And then people are given their own entry link. And then you can define, hey, we want you to go through this within 1 month, or we want you to go through this in 1 week, or you can set the parameters on how you want them to go through the class and who's going to follow up with them for discussions. And it allows you to kind of control when you release those seats to people for the class, and you work out your own timing your way, and you have total control over all of that. So I hope that by creating this, I've made it actually easier for you to work through overwhelm and more helpful for your own team. So if you have any questions or need to reach me, my email is there, and feel free to reach out to me. And I look forward to hearing about how this process is going for your team.